I hear, and Manan, you probably can relate to it as well because you've done your post-graduation. And an average doctor sees in 5 to 10 minutes a patient in India and then prescribes a medication and discharges them. That happens in medicine or in probably in orthopedics as well, and so in psychiatry too. But over here, an average consultation is like half an hour to 1 hour. So how does the transition? How can they understand? Because they probably come with the mindset that, okay, I've diagnosed in the first 5 minutes, and then this is the medication I should be prescribing them. So how do they transition to this? And is it the monitoring, which is a crucial one that they need to learn, and MHA? You're on mute, Manan.
Sorry. I think there's a mix of everything. So if we're looking at the MRC psych exams, when you'll sit for your CASC exams, which is a part 3, you don't have a lot of time for a whole scenario. And the main reason why the system designs stations to be 7 minutes or 8 minutes, even when you're giving the PLAB, the stations, if I'm not wrong, are 5 or 6 minutes, is because the system wants you to be able to see patients rapidly, make a diagnostic assessment, because that will also happen. A lot of times people, when they move countries, they think that, oh, here in the UK, I will have at least 45 minutes to 1 hour for a patient. You wouldn't always. There will be times when you will be, say, in a liaison placement or even in a community placement when you've got 2 people waiting. You're in an inpatient setting where you've got to deal with 5 different things. You might not always have that structured 45 minutes for the clinical consultation. Also, the main change also is another change that you want to get used to is the documentation side of things. Producing a comprehensive clinic letter or making ward round summaries, all of those things are very important as well. I think there's a bit of both. There are consultations I'm aware of in India which also go on for half an hour, 45 minutes, initial history taking. Of course, in my department where I did my training, our initial history taking sessions used to last 2 hours, 3 hours. Of course, in an outpatient setting, things are different. But the quality of records that you produce in an inpatient psychiatry setting in India is almost at par as what an inpatient clerking here is if you're in a good teaching hospital. So these are things, the systems, like Raja said, are slightly different. The times that you'll get depend on how busy the team is, what's going on that day. You might sometimes have the full allocated time, you might also not. So it's important to be open about that.
So I say the important points, system learning is crucial and documentation is quite important. And that is where probably one of the areas where you will utilize your time, and then they need to learn to be efficient, because I've recognized some doctors actually with 30, 45 minutes, new doctors who have recruited kind of struggle sometimes because they think that there is less time. While they were happy with 5 minutes with the patient in India, with 45 minutes, they couldn't even accommodate and work in there. I guess it's predominantly because we follow a structured pattern, or maybe a defensive medicine as well. I mean, at least from any perspective, I can say that. But this is the right way.